Happy fall, and welcome back to Let's Get Oral. Today, we're continuing our IDM Totality of Care series by sharing our conversation with Michelle Zoltan and Dr. David Alfi, an innovative jaw surgeon who is helping to lead the way we treat airway disorders. If you listened to our previous IDM episode with Victor and Sydney Avis, then you may remember hearing them mention how Dr. Alfi has revolutionized the patient experience with new technologies and techniques that lead to faster recovery times and an overall better outcome. To learn more about his journey as an oral surgeon, tune into this discussion on corrective jaw surgery and airway disorders with Michelle and Dr. Alfi.
Let's get oral. Let's get oral.
Howdy, howdy. We are back here at the 2024 Totality of Care Symposium, and I have the pleasure of sitting with Dr. David Alfi and Michelle.
Hey.
Good to be here.
I love being able to sit with someone in Houston, Texas, that's just my hometown, so I feel like I got family in the room. But one of the first questions we've had for all the guests throughout the symposium is, tell us a bit about your journey and how that led you to the Totality of Care Symposium.
So I'm an oral and maxillofacial surgeon, so a jaw surgeon. I specialize in jaw reconstruction, more specifically something we call orthognathic surgery, which is treatment of bad bites traditionally. So open bites, over bites, under bites, asymmetric bites, and much more recently a tremendous tool to bring jaws forward to open up the airways, which we can talk about. There's a huge epidemic of that. Probably the majority of people today have an upper airway disorder related to their jaws. Evolutionary reasons for it, but it's a huge deal. And so the surgery that I've now do pretty much entirely, 90% or more of my practice is for this, is to open up the airways. And that brought me here because we were actually on the road in Dallas. At some point, we decided that the more that people know about this operation would be an amazing thing. It's just about awareness, because this was an operation that took 6, 7, 8 hours and had horrible recoveries and instability and relapses. And it was a surgery that I loved for the transformations, but something that I personally wouldn't even recommend to anyone that I cared for because of how difficult it was to recover from. But over the years, we've been able to change this procedure from an 8-hour procedure to a 1-hour procedure.
Wow.
And a lot more different things, like not having to use braces. We can do it with Invisalign. We don't wire people shut. We don't put elastics. We don't use drains. We don't use splints. So it's a completely different operation and recovery. But the public still doesn't know that yet, because it's very recent that we've gotten to where we are. So it's a powerful tool in medicine and something that can definitely impact life for so many people. But it's just a matter of educating even the medical community that this is a possibility. So we decided to go to Dallas for a dental conference and put a booth there, just like Colgate would, and just be there and meet other dentists and just spread the word. And Michelle went first. She got there a day before we did, and she set up a booth, and there was, it was a little more challenging than we expected. There wasn't a lot of traffic. It wasn't a well-attended meeting to begin with.
Well, yeah, that, and also people didn't really understand why we have a booth. They were like, you're an oral surgery clinic, why would you have a booth? But then when David showed up with his brother Johnny, he's like, okay, we need to get some sort of traffic here. So then next day we went and got
Yeah, so we said we need to get some kind of noise. We're here. Nobody's coming. So I said, let's just go get the biggest movie theater box candy from Target and fill up our table with it.
With candy.
Bribing with sweets.
Yeah.
You've got
Yeah.
me.
What better way to get dentists to your table than
and
candy?
the big candy, not the little Halloween ones.
Right.
And then we got these obnoxious looking water bottles that were called Liquid Death.
That had
Have you
like
seen
skulls
those?
on them.
Yep. I'm very
Which,
familiar with
Yeah.
that.
ironically, those skulls on the Liquid Death waters are directly parallel to what we do because we work with skulls.
Yeah, there's some association
so,
there.
in a way, it kind of worked out for us.
Subliminal branding.
Yeah, exactly. But really, it was just a little bit in your face, different on the table, and we started to get more traffic. But more importantly, we got the attention of someone at the booth next to us, who you may know, Deb.
I think I've heard of Deb.
Who hasn't?
So Deb was fascinated by it all, and we got to talk and get to know each other, and she thought it was really,
Neat that
neat, important that we met and not a coincidence. And she had been almost searching for a close friend of hers, Victor in Sydney, for a solution to this jaw surgery problem, because people need it, but it was a operation that nobody wanted, as everybody knows it. So when she heard that we can do it in an hour, do it completely different, in a way that's accessible, she said, we need to meet and put you in touch with Victor in Sydney. So again, coincidentally, we were in Orlando 2 weeks later.
Yeah. And
At another meeting, and she organized a dinner, and we met with Victor, Sydney, with Gina, and we had a wonderful meeting of the minds, and really nice, like-minded conversation, and it was very nice. Now we're all very close friends, and it was a cool start to that, and then it's evolved to meeting Whit and Laura. And putting this whole thing together. We came to Knoxville as a group in November, I think.
Yeah, it was November.
Yeah, like 6 months ago. And we had this idea of this Totality of Care Symposium. And we met in this school and came up with what we want to do. And they put it together, and we're here.
Yeah.
That's
the story.
And nothing is a coincidence, like Deb says, because, why would we all meet? And her booth was right next to ours.
right.
There's alternative forces here.
Yeah.
Right. If either one of y'all were at a different segment of the hallway or in a different part of the vendor room, you're right.
We never would have met.
Wow.
Yeah.
That's a fascinating story.
Yeah.
I want to say two things. I love the motivation and dedication in terms of the spreading the awareness, right? Because that's, I think, a key thread that for all of us here in the name of improving one's health.
Yeah,
But
absolutely.
the fact that you all augment a procedure and a process that goes from 8 hours to 1 hour, could you elaborate on how you went about either teaching yourself or training and resources for being able to do so?
That's all him.
Really.
He's amazing.
The way I do it now is self-taught, for sure. But I had good mentors that taught me how to do the traditional jaw surgery and helped me fall in love with it. But like I said, it was something that we would talk people out of doing unless they really, really needed it. Now I know everybody really needs it, but that definition has changed because of what that operation and recovery meant. And I just had a real fascination for not falling behind and realizing that things change quickly and things can get better. And it was almost a sticking point for me early in my medical career, in the fact that I had, I would look at my mentors in surgery at that time the way I did look at NBA players when I was a child. Really looked up to them. They, to me, were my heroes, my celebrities. And I admired the ones that were changing things making things better. And on the opposite side of the spectrum, I had a really bad taste or bad kind of feeling about the surgeons that were older that just were stagnant, that were doing the same things they had done for 20 years and had fallen behind. Because when you're a resident, as a resident in surgery, you're trying to read everything that's up to date, and you're really on the pulse. And even though you don't know how to do it well or not exposed to it, you're on the pulse. So it becomes evident when you see surgeons, even the ones that are teaching you, when they fall behind or they don't even know where that pulse is. It was one of those things that I really, really held on to when I started my career, that I never want to be those people that I have poor feelings about. And I always want to be ahead of the curve and, fighting for new knowledge and helping make things change. So it's almost an obsession that started when I was practicing, that every day, every time I do an operation, just have a thought, what could be done better? What are we doing that doesn't need to be done? Things, those kind of thoughts. And I still do it today. Every operation changes. And, we got to an hour from 8 hours 3 years ago. And now I'm almost always under an hour. We've got to as little as 39 minutes for a double jaw surgery. And this is not with rushing at all.
No, he doesn't rush.
Anyone that comes into my operating room, I have a lot of surgeons that want to see it live. They'll come, and I'll even stop and show them what we're doing, answer questions. Well, we're always talking. It's a very relaxed environment, but the time is fast because of the technology and
it's almost
protocols.
like time stops for you in the OR. It's crazy because you look down, he's doing his thing, and then you look up and you're like, oh, only like 20 minutes have passed? What?
That's underwhelming.
Yeah. It's crazy. And then if you know him, like, this is what I always say, if you know him, he walks slow. He takes his time on everything. So you're like, sometimes I have to rush him. I'm like, all right, come on. We got to go. We got to start walking faster. We're late. And he already has a very slow temperament, like a very relaxed and like chill temperament. He's not the type of person who would just rush through anything. So that's where like the misconception is, because we do get those questions all the time. We're on Instagram and TikTok, and we do get a lot of patients who are like, how do you do it? Like, do you guys just like, are you cutting corners? And no, he's not. He really is. It's all the advancement of the technology, but also his understanding of what he does, which is so important because, yeah, the technology's there, but if you don't understand what you're doing, then you're never really going to not just get to that time, but really understand how to fix the issue that you're working with.
Right.
Yeah, that criticism is funny to me because nobody's ever said I was fast at anything in my life or that I rushed through anything. So it's kind of funny that I do an operation faster, much faster than anyone in the world, but that it's not.
It's not because you're rushing.
That's not. Yeah, I was, in school, I did very well in school taking tests. I was always on the top of the class, but I was always the last to finish the test. Yeah. I was never the type of person to rush through anything. Right. So it is a funny. It's an interesting criticism that comes
with it. Yeah.
Well, I appreciate your patience. And I can only imagine how just that was Black Mamba mentality, essentially, that you described as someone who tells me.
We're all about the Mamba mentality.
Right. And so, like, I was a Kobe fan, too.
Nice.
So you understand.
I understand, but as a Rockets fan, it was understanding from the opponent's side.
Right. Yeah.
But,
with more pain.
Exactly. But I respected it, right?
For sure.
With that said, though, I would love to hear where your observations and then follow through came through with seeing the importance of understanding the role that Airway plays
that's a great
in your
question.
practice, and how you took steps to be able to integrate either methods or practices to highlight how you can help people through such procedures.
Yeah.
That's a great question. Yeah, because it's something that is never anywhere in formal education.
Right.
I didn't get any. I went to dental school, medical school, surgical training. I didn't get it anywhere. And I went to an amazing educational institution, Columbia University. And it's not something that I really found anywhere in the literature either. So But instead, it was just through, working hard, taking care of people. And I've been practicing 12 years, and I don't really ever take time off. I'll argue that I've operated more than anyone in the last 12 years.
Wow.
He doesn't
Anywhere.
take any time off.
I do, more operations than anyone, and put more time into it than anyone. So it's through that experience, though, and I love it. To me, it's not work. I don't believe in this work-life balance situation. For me, it's all one continuum, and I love what I do. But the result of that has been treating a lot of people and learning from each one of them. And with the Airway specifically, it's one of those things that once you see it, you can't unsee it. It's so obvious.
Yeah.
It's not obvious, but once it's obvious, it's so obvious.
Well, could you elaborate on, was it a case study or was it a collection
It was a collection of cases. So, I remember even in my first year of practice taking on a young woman with cerebral palsy who had a really small lower jaw severely, and she had a really, really severe cerebral palsy where that was riddled with a lot of anxiety. She was not verbal, and the family really struggled because of not only her condition, but also because her lower jaw was so deficient that breathing was an issue. She had bad sleep apnea, which we only thought could have been exacerbated by the poor sleep, but at the time we really didn't understand that. So it was such an obvious reason to operate, even given the severity of the operation at the time, but we decided to put her jaw forward. And, this is even with the more traditional techniques and long procedure. But the outcome she had was really tremendous, and something that impacted me even early on as case point number one in the thousands of case points that started to change the idea. But her anxiety improved tremendously. More quality of life for her and her family improved a lot. And it was something to just take notice to. And then next case, I remember having a pilot that was grounded from his sleep apnea. He couldn't fly anymore and really shook up his life. Ooh. And I did jaw surgery on him to bring his jaws forward, and remember all the good things that happened to him. And then, those two cases became 100 cases. And then at some point along the line, these light bulbs go off like, hey, there's something to this. People need to breathe. And now it's obvious to me. I'd see it clear as day in that a lot of people have jaw problems. And we know this evolutionarily. If you look at skulls from thousands of years, and even literature from thousands of years, something that's well established, not controversial at all, our jaws are much smaller now than they used to be. At some point, for many years, humans had enough room for their wisdom teeth. They had straight teeth. They had wide jaws. And now nobody does. And it's so prevalent that nobody does that we think it's normal. We think it's normal that it's just like a rite of passage. Everybody gets their wisdom teeth out. Everybody goes through braces. Just the fact of needing braces with teeth crowding, by definition, means the jaws are too small for those teeth. And we never really looked at that way in medicine or dentistry. We're just fixing the crowded teeth by trying to straighten them without really understanding, or taking out wisdom teeth because they had problems. Why are we developing teeth with no room for them? Why are we have mouths with no room for our teeth? And then what does that mean downstream? Is there room for the tongue? Is there room for the nose? And the answer is no. And so a lot of people, almost everybody, if you accept what science and anthropology actually has evidence to show us, that our skulls or jaws are much smaller, if you accept that, then you'll accept that everybody has upper airway issues. And we see that, so many adults have sleep apnea diagnosed, so many more have it undiagnosed, and so many more fall in that spectrum where they wouldn't meet a criteria for diagnosis, but they have airway resistance, probably 100% of the population, if not close to that.
Wow.
So it's interesting.
Wow. Yeah, it's like, in hindsight, with all that said, it just makes sense from the introduction of the Industrial Revolution.
Right.
to having baby formula and the reduction of breastfeeding.
Correct.
And Western and certain developed societies and communities.
Yeah.
It's undeniable that these types of factors contributed to our mouse
Undeniable.
Our jaws and mouths becoming
Yeah.
smaller, and then
Yeah.
how that cascade leading to
Correct.
airway and
And-
breathing issues.
Yeah.
And we
right?
eat so many soft foods now. Like
Yes.
we don't
Yeah.
eat any nuts. Like people don't think about how much work your jaws actually need in order to stay healthy. Because when you're over here eating like mashed potatoes and like cooked, well, obviously we need to be eating cooked meat now, but like back in the day they were eating
was
like
tough.
raw meat,
Yeah.
and you had to like pull and
Yeah.
tug and pull, and that strengthened your jaw.
Yeah, and it's really interesting for you to bring it up, and some people in this circle will talk about it, but it's fascinating that it's met with a lot of skepticism, right? And people will consider it even speculative, where actually there's so much factual evidence to suggest that this is real. You know, if you go with a timeline, pre-industrial, pre-agricultural revolutions, there's clear data to show that the skull's changed. And then you look at when Nestle introduced formula over 100 years ago, and again, clear change. So it's like you have these evolutionary changes that are documented, established, the skulls are still here to observe. And then even scientifically, there's so many animal studies that show changes in diet. And I'm talking about rats, ferrets, monkeys, pigs, dogs. There's almost every species. This has been studied for hundreds of years. And there's scientific studies controlled that'll show that diet will change the development and size of the jaws. And then so you have real evidence, you have scientific studied evidence and trials, and then you even have modern day societal evidence in that if you look in northern Tanzania, there's a tribe of, I think, 1,000 people that are still hunters and gatherers in their tribe. I forget the name of them. But 300 of those people out of the 1,000 are actually still hunter-gatherers, where the others are not.
Oh, that's an amazing opportunity for a study,
and
right?
even
right?
in that group, the hunters and gatherers have amazing jaws. And even amongst those 300 out of the 1,000, the other 700 who are still part of that same indigenous tribe, but not purely hunter-gatherers and a little more industrialized, have different jaws. So it's like the evidence
they're
is
still
everywhere,
breathing better
and it's
than
really
us.
interesting. Correct.
Right, I'm sure due to other environmental factors.
Yeah, for sure.
So it's interesting. And it's easy to get in the rabbit hole with this.
Right.
Yeah.
That's fascinating. So you mentioned earlier that you sound like you have peers and other surgeons who you're interested in learning about this.
Yeah.
For our listeners who are dentists or various surgeons, do you have any links or resources that you could recommend for them to continue on that education as students?
Yeah, absolutely.
I mean, I run his social media, and I am going to tell you that we do a lot of educational content. I think with how new everything is and him being pretty much the pioneer in the technology and the technique, it's a little bit difficult to find up-to-date information on how this can be fixed surgically, because a lot of people are still learning, and a lot of people, it takes a lot of time. I mean, he's been in practice for 12 years and he's been perfecting this specific surgery for airway for over 6 years, right?
Yeah.
6 years. So
Yeah.
it takes time, and while other surgeons get trained, we talk about this all the time, that like our biggest problem and competition is that not enough surgeons do what he does.
Yeah.
And when he comes out and says like your airway can be improved and it's an
Easier recovery.
easier
it's a quicker
recovery,
operation, more
yeah.
stable.
we get the pushback of, well, you're
People don't
crazy.
People don't believe
You
it
know?
because it's not commonplace. But I think that in the next 5-10 years, this will become standard, and
For
there will
everybody,
be
yeah.
many more surgeons like me who can do this.
Yes, absolutely.
In the meantime, we're doing all we can to spread the knowledge, spread the word. I teach a fellowship, so I have a surgeon every year that I train. I welcome surgeons and students all the time into the operating room. I
Yeah.
say yes to almost every lecture that I'm asked to give. I've given talks at already 5 university teaching programs this year.
Yeah, that's true.
And 2 national meetings.
Yeah, and then like I said, we post
but yeah,
this,
go to on Instagram, TikTok, or YouTube. It's at dr.davidalfi, and we're putting a lot of information there. We're always available to interact, answer questions, and communicate. It's a passion for me, for us.
Yeah.
So.
And Airway
reach
Revolution
out.
as well.
Love it.
Yeah, Airway Revolution, they're doing an amazing job spreading the word too, and they're going to have the huge resource for information as well. So,
Like overall.
Yeah.
Because we're more jaw surgery related, so we do a lot of content on how to fix the airway. They're looking at a little bit
everything.
more full
So they're
scope.
really into the totality of care that this meeting we're here is about. So the nice thing is we're meeting, and there are a lot more champions out there that are leading this. I call it a revolution, but it's an exciting one because I think that it's going to impact medicine as we know it. And in my generation, learning medicine for the last 20 years, I can't think of one bigger opportunity or paradigm shift as the airway paradigm shift has for humanity. So I think it's really important. It's a cool time to be alive.
Yeah.
I couldn't agree more. That's fantastic. One last question. As a speaker and participant for this symposium, it's been great being able to interview with everyone, learn more about their stories, but also would like for our listeners to hear, is there anything new you've gathered from the other speakers or professionals here that made you go, I had no idea, or, oh my gosh, that's something that I would love to take back into my practice or realm?
Yeah, I think the biggest thing for me was the appreciation that I'm not alone on an island. And a lot of what I'm hearing, these practitioners, these leading practitioners, in their own pathway have found this, very parallel thoughts and philosophies to what I've had through my grind. And to me, that's the biggest thing here is that there is a network out there, and we're not on an island. And I'm more encouraged than ever that this message will spread and medicine will become better going forward.
I'd say the same thing. Because sometimes we would think like, oh, we're just crazy for thinking all these things. And then we're listening to everybody and we're like, okay, wait, everybody has come to the same exact conclusion that we have come to, which is that airway is literally the issue. That so many people suffer with airway, and that's causing all of these other underlying issues that people deal with, like anxiety, ADHD, etc. So the fact that we all have come to the same conclusion, like he said, all have come to the same conclusion from a different path is a very powerful thing, because then we all must be on to something.
Exactly. Yeah, our first interview was with Dr. Bill Hang, and after that I was like, well, I guess I'm getting paper tape and going to be taping my mouth closed when I go to sleep.
Yeah, mouth taping is amazing. It's amazing. But you got to make sure you can breathe through your nose first, because if you have a lot of nose blockage, then you're really just suffocating yourself.
It is funny, though, because we made a fun post about it yesterday on Instagram, but it's... when you look at it, of course, the nose is there for breathing, right? Mm-hmm. But how many people actually think about, we should be breathing through our nose? The majority of people today breathe through their mouth without even thinking about it. And it's just so elementary. It's funny.
Yeah.
Yeah, I relatively pretty conscious about my breathing, but I think it's from being an athlete. I studied soccer most of my life. And it particularly track and field. Right. And being a sprinter, the breathing mechanics for efficient running and the training was really hammered into me. And so that's translated to me being a bit more conscious as well as I can be with breathing through my nose. And then fast forward, I am like, in my day-to-day life these days, I'm like a quasi-food scientist.
Nice.
Love it.
That's my way to say, I'm not a foodie, I'm an eater, but I do love understanding the science and biology of food and flavors and how that can influence our own behaviors for
Yeah.
improving quality of life.
Yeah, that's
Oh,
interesting.
absolutely.
And in the name of Airway, neurogastronomy and the role of retronasal breathing, I didn't realize how key that was for how we as humans perceive the flavors of food, right? It's one thing to say I had a garlic bulb up here and, cracked it open. It's one thing for us to initially smell that garlic, but I think most people think of how garlic smells when they're chewing, and that retronasal effect. And similarly
That's
for
interesting.
fruits,
Yeah.
broccoli, and whatnot. So while it's not breathing related when it comes to like sleep apnea and whatnot, I'm really trying to leverage this research to better understand how I can educate my consumers and clients, whether it's on formulation or their cooking techniques,
Yeah.
to maximize the opportunities of eating healthy foods and goods
Yep.
for it to be either enjoyable or
Yeah.
more tolerable.
Yeah.
And
Develop
I
better
think
habits.
Yeah.
exactly, because especially kids, right? Like
Yeah.
Oh my
the
gosh,
kids
yes.
who don't
Yeah.
want a stinky broccoli
Yeah.
and whatnot. Like, how do we find ways for them to consume these things that are the fiber and the things that are good for them? But do it in a way that
Yeah.
if
And
it's
chew. They need to chew.
and to
They
chew.
need to chew.
Yes, yeah, and the
Chewing is so important.
the chewing is it's essential, right? Like
Yep.
the
Yes.
amylase production, the salivary flow
Yeah.
production that comes from it,
Yeah.
spreading around those nutrients, and
Yeah.
again, getting back to that retronasal breathing. It's,
Yeah.
I mean, me personally, like, I just remember like growing up in a southern household. I remember my mom would make greens and just how the house would smell, and I was like,
There was an
I
aversion
don't
to
want
it.
these greens.
Yeah.
Now,
You're like, love it.
Yeah.
Yeah. It's so crazy how your palate changes as you get older.
right, I love it, and it's also something like comforting now from that aroma because it brings me back home, even
Yeah,
though
that's
I
interesting.
didn't
Some
eat
nostalgia.
it then.
Yeah, it's crazy how smell is connected to memory so easily.
Yeah.
When you smell something,
so
you're like
powerful.
instantly back in.
Yeah.
And so that
You go
makes
back to infancy.
Yeah,
Right.
for real.
With the smell.
and so like this is me speculating, but I'd be curious to know if you did studies for those who are categorized knowing as mouth breathers versus those who do breathe through the nose. What's the state of their memory and health over time?
Well, also, don't quote me on this, but I have listened to a lot of podcasts about sleeping. And people who breathe through their mouths, obviously, they end up snoring. And then we talk about how when you snore, your tongue falls back and then it closes off your airway. And then you can't actually get into deep REM sleep. So these people are not dreaming.
Yep.
And then when you're not in deep REM sleep, you cannot build resilience throughout the night, which then helps you get through the day, which is why you're exhausted because your body has not regenerated. Because it's in deep and REM sleep is when your body completely relaxes in order for it to
Recover.
recover.
Yeah. And that's an interesting point because that's the problem with modern diagnosis of sleep apnea. Because if a home sleep study or even a poorly done study is not picking up obstructions, they'll say you don't have a problem, you're negative. But to your point, you can sleep with no obstructions because you're compensating so hard by clenching your teeth, bruxing, maneuvering, posturing, waking yourself up so that you'll never register an obstruction, but you're never getting deep sleep, REM sleep, restorative sleep. And that's a problem.
That is a huge problem.
Physiologically, that's a problem. So that we still have a huge hole in medicine where it's not being recognized in the traditional way of testing, and we're just saying obstruct or no obstruct, but we're missing the whole, hey, how are you sleeping though? Are you getting restorative sleep?
Do you dream?
Do you dream?
Because dreaming
are you getting restoration?
Yeah, because you can only dream in REM.
And so many people are not, and they're not being told that either.
Right. Well,
It's crazy.
thank you all both so
You're
much
welcome.
for sitting down with us, sharing your story
Of course.
and your experience leading here to Totality of Care. I look forward to being able to follow up y'all and get
Yeah,
you
you
on
gotta
the-
come to Houston.
Yes, you have to
the
come to
Kobe
Houston.
room.
And we'll have
Yes.
our podcast room set up by then, so maybe we could do a round two.
Yes, yes. Well,
We'll
thank
ask you
you.
how you got here.
Yeah.
Yes. Oh, you'll need at least an hour for
All
that
right,
one.
we got it. We got it.
Love it.
Thank you again.
Thank you.
Let's get oral. Uh.